Hi, everyone. Welcome to our Tuesday afternoon meeting. I am back in my home office today and wanted to share with you some information I have about vitamin D. So yesterday, actually, I was scrolling through my emails in the morning and I found an email with the subject heading, Fauci takes vitamin D. And I thought, actually, an interesting study had come out about vitamin D and immunity earlier this month. So it is a perfect time to talk to you about this very important vitamin. So first of all, you might be surprised to know that vitamin D is actually not a vitamin. It is a prohormone, which means that it gets converted into the body as a hormone. We can get some vitamin D from the diet, about 10%, and one of the best sources of vitamin D in the diet is from salmon. But most of the vitamin D comes from the sun, and when the sun interacts with our skin cells, it creates a chemical reaction that formulates this prohormone, which we call vitamin D, which then gets synthesized or further modified or activated by the kidneys into the vitamin that we know as vitamin D. I'll talk a little bit more later about what it does for us. But first of all, vitamin D deficiency is really common in the United States. It is believed that at least half of the population have vitamin D deficiency, and some studies show that as much as 80% of the population has this deficiency in this vitamin or prohormone. Interesting Kaiser study came out in Southern California a few years ago that showed that even in sunny California, over 60% of people were vitamin D deficient. Everybody is at risk, I guess, or susceptible, but certain populations have a higher rate of vitamin D deficiency. That includes those of us with darker skin tones because something in the melanin in our skin may interfere with the absorption of sunlight and the production of vitamin D. And populations who are more likely to be indoors, like healthcare workers, people who are in homes, for example, are also at greater risk. And of course, for those of us now who are home much of the time, we are all at greater risk for vitamin D deficiency. So really, again, it's very timely to talk about this vitamin. So how do we know whether or not we're deficient? Vitamin D levels are checked in the blood. And it's important to know that there's actually a really wide range of what we consider to be normal. A normal vitamin D level in the blood is anywhere from 30 to 100, which is really quite a large range. Many doctors like myself will shoot for not just a level of 30 to be considered normal, but a level of 40 or greater to be considered normal because there are some benefits we know from having a little bit higher than that minimal cutoff. But a deficiency is diagnosed or defined as a vitamin D level less than 30, insufficiency, and a true deficiency is under 20. And again, many of us fall into that subgroup. So what does vitamin D do for us? Well, the primary function of vitamin D is to help us absorb calcium. So prolonged vitamin D deficiency will result in bone loss because the body needs calcium for cellular function, which is more important in the body's mind than bone. And so if vitamin D levels fall and calcium levels fall, then the body is going to get that calcium from wherever it can, including the bones. And so people will start to develop bone loss or osteopenia or osteoporosis. So long-term vitamin D deficiency will result in bone problems. However, there are a lot of things that are associated with vitamin D deficiency, and there's a lot of other processes in which it's involved in. For example, vitamin D deficiency is associated with metabolic syndrome. It is associated with mood disorders, including depression. And more to the point right now is that vitamin D deficiency, or rather vitamin D, is important to immunity. Vitamin D treatment has been shown in people who are deficient to decrease infections, particularly respiratory and viral infections. And so vitamin D has been identified as a strategy to help prevent infections, and right now to help prevent coronavirus or COVID-19. So a study was actually published just earlier this month, the first week of September, so a couple weeks ago, in the journal JAMA, the Journal of the American Medical Association, and it looked at the association of vitamin D to having tested positive for COVID-19 or coronavirus. And they in fact found a strong correlation between testing positive for the virus and being vitamin D deficient. So the study suggests that adequate vitamin D levels may be protective against the virus because people who were in a deficient range for vitamin D were more likely to contract the virus or to have a positive test as compared to people who had normal vitamin D levels. So again, more information is necessary, and of course vitamin D is not the end-all be-all, but it is one piece in helping protect us and protecting our bodies, we think, with enhanced immunity to prevent respiratory viral infections, including COVID-19. So how much is important to supplement? How much do we supplement? It's important to know that vitamin D is a fat-soluble vitamin. That means that it hangs out in the fat. And in fact, obesity or excess weight is a risk factor for deficiency. Why? Because vitamin D is fat-soluble, it gets drawn out of the bloodstream and gets stored in our fat cells. So the more fat cells we have, the more it's going to draw that vitamin D out from the blood supply where it can be utilized and stored in the fat cells where it just kind of hangs out and doesn't do anything for us. It is not like the B vitamins, for example, that are water soluble. And that's important distinction to make because if you take a ton of B12 vitamin, for example, you will urinate the excess out. It's water soluble, it passes through the body as water, and you can't develop toxicity. Vitamin D, however, is fat soluble. So vitamin D will, again, hang out in the fat cells, and if we superdose or take too much supplementation, then it can cause toxicity of anything from kidney stones to impaired immunity to actually even seizures and coma. So it can be significant if people OD on vitamin D. The recommended daily allotment for vitamin D is 600 IUs or international units. IU is the way you'll see it on a bottle. But studies show that up to 2,000 IUs are safe and effective for most people. And in fact, in this JAMA study, the authors reported or noted that up to 4,000 IUs a day is a safe and acceptable daily intake. And so certain populations need to be wary of how much they take. But in my practice, for the average person, I recommend a minimum of 2,000 and sometimes 4,000 because a lot of my patients are coming to me for weight loss. I know that they are probably storing excess vitamin D in fat cells, and so they need a little bit more vitamin D. I personally take 4,000 to 5,000 IUs a day. But it is something that you need to be mindful of because it can cause toxicity. Keep in mind that some of you may have had blood tests done with your doctor, and I do recommend that if you haven't had your vitamin D levels ever checked, it's just a simple blood test. And if you have the true deficiency, so levels under 20, then the recommended dose is 50,000 international units or IUs per week or 10,000 IUs per day. So certain populations will be required or recommended to take mega doses. So again, vitamin D is probably one of the most important vitamins to supplement because it is one that is most widely deficient in the population. We have seen a rash of vitamin D deficiency in the United States over the last decade. And again, it is associated with many important physiologic functions, including our metabolic function, including our immunity. And it's probably safe to say that most of us will need some kind of supplementation in the range of 2,000 to 4,000 IUs per day, and even more if you were told by your doctor that you're deficient. So I hope this has been helpful. If you have questions, and I'm going to look and see if there's any here, but if you have questions, feel free to put them in the chat. Tag your calendars, 4:30 Pacific time every Tuesday for a live. Last week we talked about insomnia, coronasomnia, and the downsides of chronic insomnia. I can't remember what we're talking about next week, but it'll be something fun, I hope. And if you want more information, feel free to check out our website at delnutrition.com. You can sign up for my weekly newsletter that I personally curate to give you more information about health and wellness, and joining our page and our group for more regular tips, inspiration, and recommendations. Have a great week in good health, and I'll talk to you next week. Bye-bye.